Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hello, this is Dr. Nicholas Biasotto. I'm the host of the Medical Society of Delaware podcast, Delaware Healthcare Reality. And our subject today is artificial intelligence and its future in medicine. And before I introduce our very experienced guest, I would like to make a brief introduction. Artificial intelligence, AI, is already reshaping medicine today, and its future may be transformative. However, it raises significant challenge for the future practice of medicine. In general, AI may revolutionize the lives of human beings, from gathering information to easing the daily lives of the human race. Today, in our podcast, we will discuss AI's effect on the practice of medicine. But beyond medicine, this technology may reshape the world. Some of these reformations will benefit mankind, but like all technological advances, it may potentially carry risks. And I'd like to call to mind to the audience, if you recall, author Isaac Asimov in the 1950s, when computers were just about getting started, wrote three short stories about this technology called iRobot. He outlined the dangers of an unhinged technology in those short stories, where his three rules of robotics, dictating the protection of its creator, became ignored by the product of man's creation. So that's just a bit of food for thought. I'd like to introduce our guest today. This is Dr. Alex Ding. Dr. Ding is a board-certified diagnostic and interventional radiologist. He's a fellow in the American College of Radiology. He's a practicing physician, currently teaching and providing clinical care as an associate professor at the University of Louisville School of Medicine. He is an industry mentor to students at the University of Louisville Bluegrass Biodesign and the Stanford Clinical Informatics and Management degree programs. He was previously managing partner at California Advanced Imaging, vice chief of the medical staff at San Mateo County Medical Center, and chief radiologist and medical director of imaging at Sutter Health. Dr. Ding represents the American Medical Society on the Association for the Advancement of Medical Instrumentation, AI's committee, and is member of the steering committee of the HL7 Da Vinci Project. He serves as an advisor to multiple health technology companies, health technology innovation funds, and the FDA in the Total Product Life Cycle Advisory Program. Dr. Ding was a gubernatorial appointee to the Board of Directors of the California Health Professionals Education Foundation. Prior to being elected to the AMA Board of Trustees in 2022, Dr. Ding served on the American Medical Association Council on Science and Public Health, including as its chair during the COVID-19 pandemic. He previously served on the AMA Board of Trustees as a resident, the AMA Council of Legislation, and the AMPAC Board of Directors. Dr. Ding currently serves on the AMA Board's Finance Committee, as well as its Audit Committee, which he previously chaired. In addition, he is co-vice chair of the American Medical Association's Firearm Injury Prevention Task Force and a liaison to the AMA Council on Science and Public Health, the AMA Youth Physician Section, and the AMA Truth, Reconciliation, Healing, and Transformation Task Force. He earned his BA degree in Public Health from the University of California, a master's degree in Public Health at the University of California, and his BA in economics. He holds an MBA in finance from the Wharton School of University of Pennsylvania, and MD received from the University of California, San Francisco. He completed his residency and fellowship at the Massachusetts General Hospital and Harvard Medical School. He is a U.S. Navy veteran, native of San Francisco Bay, And Dr. Ding now resides in Louisville, Kentucky with his wife, Kimberly. He's an educator who has 2 children, 2 sons. Welcome, Dr. Ding. How are you,
Great. Well,
Alex?
I'm great. Thank you so much, Nick, for having me on the podcast. It is a real honor to be here.
And
Before
it's
we get things started, I do want to say that at the AMA, we often prefer the term augmented intelligence rather than artificial intelligence, because
okay.
we really see these tools as something that is meant to enhance physicians' judgment. It's not to replace physicians. And I think that's a good frame for our conversation today. I think AI is exciting. It's disruptive. It is our job to make sure it is developed and used in ways that keep patients safe and preserve the integrity of the patient-physician relationship.
Very good. I hope you've had a chance to listen to our some of our other podcasts so you understand the format. And I will refer you, because this is a typical conversation, as Alex, and you can call me Nick.
Absolutely.
All right.
I appreciate that.
My first question to you, Alex. How did you become interested in AI and evolve into the spokesperson for this technology in the AMA?
Yeah, well, Nick, I think that's a great place for us to start today. I think part of it comes from being a radiologist. As a specialty, we've, can really considered ourselves as the tech geeks of medicine in many ways. We're the ones to first deploy a number of new technologies in healthcare. If you think about it, radiology pioneered things that now everyone takes for granted. We were the first to digitize medicine. We adopted PACS early on, which, if you think about it, is kind of a proto-EMR. We adopted voice recognition, natural language processing, and computer-based advanced imaging modalities that have really transformed diagnosis. So there's a great book by Dr. Bob Wachter. He's at UCSF. He's the chief of medicine there. It's called The Digital Doctor. And in the book, he calls radiologists the canary in the coal mine when it comes to medicine and digital transformation. We often see new technology first. And as part of that, we see both its promise and its pitfalls before a lot of the rest of the medical community does. And so it's not surprising that radiology is one of the first specialties to really dive headfirst into AI. And, for us in radiology today, I would say AI is not just a theoretical thing. It's actually a regular work tool for many of our colleagues. In fact, surveys from the American College of Radiology and the Radiological Society of North America show that about 2/3 of radiology practices in the US are using some form of AI in their daily workflow. And then for me personally, my interest really, really deepened when I joined Google. So I was their first radiologist that they brought on to figure out how to apply machine learning and AI algorithms to healthcare, more specifically medical imaging. And I think for me, that experience gave me a front row seat to the potential of these tools, but also helped me understand the limitations, the pitfalls, the challenges, really how hard it is to make sure that AI is clinically validated, safe, unbiased, and usable in the real world of medicine. And so when I stepped into leadership roles at the AMA, I think it was natural for me to take on in this space. The AMA needed physician voices to guide policy and governance around AI. And I have both that specialty background and also the tech experience. And so it's been really rewarding to help shape how we as physicians talk about AI, not as something that's going to replace us, but as I mentioned, as augmented intelligence, something that is meant to strengthen the work that we do for patients.
Well, very impressive. And I think that's what we're going to move into now in discussing all of these parts that you just mentioned. Okay, how do you envision the effect of AI on the future of medicine in America and the world as a whole? I'm going to list the five or six questions that I have, and then we'll come back to the first one. How will it improve diagnosis and early detection? How will it personalize medicine by integrating genetics and lifestyles and clinical data to tailor treatment? How will it give the clinician support in decision making? How will it improve operational efficiency by streamlining tasks to ease the burden on the clinician today? And we do suffer many of those burdens. How will it enhance and enable telemedicine and diagnostic tools to bring high quality care to underserved areas in the world? And my last question in this section will be, will it accelerate research, especially in drug development, lessening the time that a drug may come to market? So let's go back to the first one. How do you think it's going to improve diagnosis and early detection, Alex?
Yeah, I mean, I think, Nick, you've started with a great list of the various different use cases and opportunities. And just starting with that first one, I think this is probably the area where AI is having some of the most visible impact. So you can think about AI as analyzing images, laboratory data, pathology slides, you can pick up patterns that are less perceptible to the human eye. So again, in my specialty in radiology, for example, AI tools can flag a possible pulmonary embolism on a chest CT and move that study to the top of the work list so that the patient gets attention, hours, even days faster. And that kind of time can literally save lives. And just one example that we have in our day-to-day workflow is, I've seen multiple of these cases where an outpatient cancer patient comes in. Again, this is an outpatient. They come in for a routine staging scan as an outpatient, and we find that there might be a PE. And normally, again, as an outpatient routine scan, we would have read this 2, 3, 4 days later. But instead, with this AI module, it immediately gets flagged, pulls it up to the top of the work list, flags it for a radiologist to look at right now while the patient is still in the department. And I would say, it's not just imaging. I would say AI is really good at taking tons of data and using it as a predictive tool, predicting which patients might develop conditions like sepsis or heart failure before they become critically ill, or at least early on enough where clinical intervention is going to be much more meaningful in preventing that acute on chronic deterioration. But I would say, of course, physicians are really still going to have to be the ones that interpret and confirm those results. AI, you really have to think about it as a support tool. It is not an autonomous one, but I really do think it has some real potential to make diagnoses earlier and more accurate as well.
Your example of early detection, that's pretty interesting. Picking that P up right away while they're right on the floor, being imaged. All right, how about personalized medicine by integrating genetic lifestyles and clinical data to tailor treatment? That's important. Talk to me about that.
Yeah, I would say in this use case, this is where AI's ability to handle massive amounts of data sets really shines. And personalized medicine really means tailoring treatment to the individual, not just the disease that we're trying to treat or manage. And AI, just as you suggested, can pull together a ton of disparate data. So genetic information, lab values, lifestyle data from from wearables, from the electronic medical record, from even claims data, and it can kind of pull it all together, look for patterns that help predict which treatment is most likely going to work for a specific patient. And so that could mean something like choosing the right chemotherapy for a cancer patient that is based on their tumor genetics, or flagging which patients with diabetes are most at risk of complications based on some of this data of their activity, diet, lab trends. And the hope here is that rather than expecting physicians to intake and digest reams and terabytes of data that they certainly most don't have the time for, that AI would be able to do this. They would be able to pull that proverbial needle from the haystack, because I think that there's no realistic expectation that any physician alone or any practice alone can process all of this data, let alone in real time. But certainly AI can. And then, when it does that, the doctor can then use those insights to truly make a personalized care plan. And I think that's what the promise of AI is here.
Wow, interesting. I think you already answered the third question I had about clinician support and decision making. But how about improved operational efficiency by streamlining tasks that all of us are faced in our practice with the burden that is brought on to us by third-party payers, et cetera, to relieve the burden of the physician?
Yeah,
How do you
I
think
think
that's going to work out?
Yeah, I think this is one of the areas that I am the most excited by, because it directly addresses physician burnout, which I consider to be at epidemic levels in this country. A big part of what drives burnout is the administrative burden and load that physicians and their practices have to deal with. If you want to talk about paperwork,
True.
documentation, and oftentimes when I
True.
talk to non-clinical people, they don't recognize that burden. And I often have to spell it out to them in terms of what that means, in terms of how your doctor is actually spending their time. which is not really in the way that they prefer, and really how farcical it has become. And I know that your listeners, as physicians, they know completely the pain that we're both talking about. And I think AI can really help here in very concrete ways. So as one example, ambient AI can generate clinical notes just by listening to that clinical conversation and encounter. Natural language processing can be used to help with coding or quality reporting. And then automation can streamline prior authorization requests. It's just a couple of ways in which you can imagine that. And I would just say that, if AI can give us back 30 minutes a day by reducing that clerical
Wow.
load, that is more
Please.
time that we can spend with patients. But I would
Mhm.
argue that even better would be if that can reduce the pajama time that we're all accustomed to so that we can spend
Mhm.
more time with our families, because I really think that it is an imperative that we use AI for this particular opportunity to make the work of medicine more sustainable for the workforce.
Wow, good. And we have many underserved areas in the world where people are suffering from diseases which we can really help them with. How can we enhance and enable telemedicine and diagnostic tools to bring high quality of care to those areas? How do you envision that as occurring?
Yeah, I think this is a really important opportunity. One of the things that we've seen is that telemedicine has exploded since the pandemic, and having been said, there are still barriers like language, bandwidth, access to specialists is just some. And I think AI can help potentially break some of those barriers down. There's some new technology that uses natural language processing and AI to do some real-time translation that might be able to help physicians and patients communicate across languages better. There are also AI-powered triage systems that can help figure out whether or not the way in which a patient is presenting, whether that you really actually need to see them in person or whether or not you can see them virtually and remotely through telemedicine. And then, of course, there are remote diagnostic tools that can support providers that are in rural or resource-limited settings where they might not have immediate access to a specialist. And I think that means that higher quality care can reach patients who traditionally have been left out of access to the medical system. But I think, one thing I'll mention here is that a big watch out for here is that the AI model, that AI algorithm is only as good as the data under which it's trained. So if all of the algorithm or if all of our algorithms are trained on Western affluent patient populations, trying to use those models in the jungles of Africa, the mountains of the Andes, the riversides of the Ganges, you're going to find that the AI actually does not perform very well. And that's just one example of how we need to understand the limitations and how these algorithms are created to really understand kind of where it's appropriate and where it might not be using this technology.
Interesting. And we know that a drug, a potential very beneficial medication, takes years and years and years to come to the market. Animal studies, etc. How do we do you envision it as accelerating research to bring that drug development in a lesser amount of time so that we can have these beneficial drugs brought to the public early?
Yeah, and I think we're already
How
seeing.
would that happen?
Yeah, I think we're already seeing real world examples of this already happening. So just as you mentioned, drug development is traditionally incredibly slow. It's expensive, and AI has the potential to speed that up dramatically by doing a number of things, including sifting through massive data sets, predicting how molecules will behave, like how proteins will fold as one example, even identifying brand new drug candidates. So a great case study is if you look at antibiotics. So in 2020, MIT researchers used AI to discover a new antibiotic called Halicin, and that worked against drug-resistant bacteria. Then again, in 2023, another antibiotic, Abaucin, was also identified using AI, which proved to be effective against Acinetobacter. And so I think
Wow.
these are examples of AI not just being theoretical in drug discovery, that it's already happening. And I think if we can scale that approach, AI can really shorten the time from bench to bedside, which I think will translate into reduced cost for the whole development process. And then ultimately, our hope is really bring life-saving treatments to patients much, much faster.
Nice, nice. All right, this has been a very interesting conversation so far, but I'd like to take about a 5-minute break so that we at the Medical Society can tell our listeners, physicians in the area, some of the things we have coming up in the near future in our meetings, and what we can show them about how to make their practice better and learn something, as well as educational programs that are going on during that time. So we'll take a 5-minute break and we'll be back.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Hi, this is Dr. Nick Biasotto, your host to the podcast of the Medical Society of Delaware, Delaware Healthcare Reality. Just to let you know, we have 3 big events coming up for the Medical Society of Delaware. On October 18th, the Superhero for Hope 5K Health Fair and Food Drive will occur at Rockford Park. Keep that in mind. On October 23rd, as part of MSD's annual meeting week, a virtual CME program with this year's theme, The Body Connected Healthcare Wearables, will occur. And don't miss the 236th annual meeting of the Council session on October 25th with keynote speaker Stephen K. Klosko, MD, MBA, author and former president of Thomas Jefferson University, who will present Swifties, Startups, and the Singularity. For details for all of the 3 events, go to the MSD website at www.medicalsocietyofdelaware.org. That is, again, www.medicalsocietyofdelaware.org. Okay, this is Dr. Nick Biasotto. We're back with Dr. Alexander Ding, and he is discussing artificial intelligence or augmented intelligence to our audience today. Alex, so of all the benefits we've discussed earlier in this podcast, what problems and challenges do you foresee for AI in the future or its implementation? I'm concerned mainly about accuracy and safety issues. Can you comment on that?
Yeah, I mean, I think just as we talked about the benefits, I think we have to be clear-eyed about the problems or the challenges that you mentioned. I think it's important to really have that conversation. I think the first thing to talk about, as you mentioned, safety and accuracy is the right first thing to talk about, because as all of your listeners know, that in healthcare, even small errors can have some major consequences. And, it's just one example of the problems with AI. So generative AI models can be prone to hallucinations. That is, producing information that sounds authoritative, it sounds correct, but it's actually simply wrong, and it's confidently wrong. And I just call it computer BS. But if a physician were to rely on that without double checking, it could really put a patient at real risk. But I do think the concerns go beyond hallucinations. So another big issue is bias. So AI models are only as good as the data on which they're trained. And if that training data underrepresents certain populations, for example, racial and ethnic minorities or women or people in rural areas, if the data inherently is biased, as the world is, and so you do expect some sort of bias within the data, that model's performance may be biased as well. But the challenge with AI is then that bias will be scaled and expanded and explode. And what that means is it could work well for some patients, but really miss the mark for others that potentially then worsen disparities that already exist in our healthcare system. Then there's also the problem of generalizability. So an algorithm that is trained in, just as an example, a large academic hospital, it may not perform the same way in a small community clinic. So if you've got different populations, different equipment, different workflows, all of these factors matter. And one of the real risks is deploying AI tool too broadly without testing how it performs across a wide range of real-world settings. And then there are even broader limitations. I think AI is really good at spotting patterns, but it doesn't understand the context. And it doesn't know but when a patient's social circumstances, a patient's values, their unique history, and how that might change the treatment plan. And I really think that that's an area where physicians are irreplaceable. And so when we talk about safety and accuracy, I think we're really talking about a package of issues. You've got accuracy of the outputs, bias in the data, generalizability across settings, and then the need for clinical validation. Just like you wouldn't approve a new drug without evidence from a diverse patient population, I don't think we should deploy AI until it's been proven safe and effective for everyone that it's meant to serve as well.
And we definitely do not want to see the erosion of the patient-doctor relationship, the lack of human touch. How important that is. I've been a practitioner for 45 years, and just laying your hand on the patient makes them feel even more comfortable and feel that, they're in good hands. The art of medicine has its benefits with empathy and trust that AI cannot give. All right, now, who will be responsible if AI systems make a mistake, a decision error, harmful decision in particular? Will the doctor, will the hospital, or the AI developers? Who will take the hit? And what federal division will be responsible for implementation and policy? Will our malpractice premiums go up? Go ahead.
Yeah, I think that's a great question. This is probably one of the biggest questions that physicians have right now. And I think it is also one of the biggest barriers to adoption as a consequence. Because doctors worry, understandably, they worry that if an AI system makes a mistake, that they're going to be the ones that are held liable. And I think that is especially concerning with something like generative AI, because just as I mentioned, these models can make stuff up. They can hallucinate. They can produce something that sounds correct, but is completely fabricated. And if a physician relies on that output without verifying it, then there's a direct malpractice risk that can come out of that. And so what does that mean in practice? I would say that it means physicians have to go into this being very cautious. AI can support our work, but it cannot replace our judgment. And at the end of the day, the standard of care still rests with the physician. And we really have to be the ones who verify the information before acting on it. But, I think what I would say a really important point here is that the responsibility cannot fall on physicians alone. So the AMA's stance is that this liability has to be shared. So developers who design the tools, the health systems that choose to deploy them, the regulators who approve them, all have a role to play here. And I think if physicians are asked to use AI, but they're the ones left holding all of the liability, that adoption is going to stall. And so that is why the AMA has been calling for a formal regulatory framework. Just like the FDA ensures only safe and effective drugs make it to market, we need similar sorts of guardrails for AI in healthcare. And that framework would ensure that only validated and safe tools ever reach physicians and patients in the first place.
That future federal scrutiny will have to be established. It hasn't been yet for AI, has it? Or do you know of any regulatory commissions that have been established?
I still think it's a work in progress. And I think, you had asked the question of which federal agency should it lie with, but we actually think that it should really be a whole of government approach. And so it's not going to sit with just one agency, but it's probably going to have to sit with multiple. And really, I think at this point, just figuring out what is the right and appropriate framework is something that is still being figured out. And then on your question on the malpractice premiums, I think there's certainly anxiety that they could go up if AI introduces new risks. But I would say there's also a flip side to that if AI is validated, it's used appropriately, it should actually reduce errors and improve safety. And I think that's one of the use cases and values that the AI can bring, which then hopefully over time should help to stabilize or even reduce liability. But I think the bottom line is that physicians have to remain cautious, and we have to use AI as a support tool, not as a replacement of our judgment. But at the same time, we really need regulators, we need developers, we need health systems to step up and share that accountability so that AI becomes something that really strengthens patient safety and trust, not something that puts physicians at further risk.
As the expression goes, your lips to God's ears. Now, I often worry about privacy. How hard is it going to be to protect it? Patient data.
Yeah, I think that is such an important concern because trust in healthcare, in large part, depends on protecting patient privacy. And I think the truth is that AI doesn't eliminate privacy risks. In some ways, it introduces new ones. So these AI systems, these algorithms, and training these models require enormous amounts of data to train them and to function well. And I think that raises real questions about how that data is stored, who has access to it, how it might be used. And we've certainly seen in other industries what can happen if data isn't safeguarded. You have breaches, you have misuse, even the sale of personal information. And in healthcare, I think the stakes are even higher because this is some of the most sensitive information that people have. And so the AMA has been really clear that strong data privacy and security protections are an absolute must-have for AI
Good.
adoption in medicine,
Good.
that patients need reassurances that their information is not going to be exposed, it's not going to be misused. And then I think physicians need confidence that the tools that they're using are going to be HIPAA compliant and compliant with other federal and state requirements as well. I think it also goes just beyond the protecting of data issue. I think there's also an issue of transparency with the data as well. I think that both patients and physicians should really know how their data is being used, whether it is to train a model or to generate insights at the point of care. And so I think that's the risk side of things, but I also think it has the potential to improve privacy in some ways. So for example, AI could be used to spot unusual patterns that could signal a data breach. It could be used to automate safeguards across privacy systems. But I would say that that only works if these privacy and security features are built in from the start, not just tacked on or thought about as an afterthought. And so to really answer your question, I don't think AI itself magically guards against data breaches, but the guarding against breaches really comes down to less about the technology, more about policy, governance, and building in of robust safeguards. And the AMA's position is really that without these protections, that adoption is going to stall because both patients and physicians really need to know that their trust is not being compromised with the data.
Yeah, we have to know that for sure. Now, do you think AI is going to lessen a doctor's clinical skills? For example, when I see students and I train them and residents when I train them, the first thing I tell them is learn, get a good book on physical diagnosis because that never changes. The lays on, you lay your hands on, you hear the murmurs, you do this, you do that. It's a good physical diagnosis that makes a good doctor, in my opinion. Will AI make us become lazy in that department?
Yeah, that's a question I think a lot about because I teach medical students and residents, and with them, I'm really clear that you need to master the fundamentals, and just like you, I insist that they study on physical diagnosis and because that I think is fundamental while technology and treatments can evolve. I would say the ability to take a history, to perform an exam, to understand the basics of medicine is fundamental and never goes away. And I think those skills are timeless. That having been said, I bet you never thought that a radiologist would tell you that the physical exam is important, did you?
No, I didn't. But that's true. That's true. I understand that. Okay. Do you fear for some subspecialties, yours included, radiology, pathology, and even primary care? Will AI take over that?
Well, Nick, if it's okay with you, there were a couple of other things I wanted to say about the clinical skills portion of it before we move on to the next item that I think a lot of people are thinking about. I think one of the real concerns that you're kind of alluding to is the idea of de-skilling, because I think if we lean too heavily on these tools, physicians may lose their sharpness in kind of the core abilities. And history has shown us that when people stop practicing certain skills, they atrophy. And it's actually something that the aviation industry thinks about a lot with their pilots and the use of autopilot. And so they work really hard to actively counteract that de-skilling. And I think in medicine, that's going to be the same thing that we're going to have to do to be able to minimize the risk of de-skilling. And so I think, the balance is really critical. On the one hand, AI should be an assistive tool. On the other hand, I think we have to make sure that doesn't become a crutch. And so physicians still have to be able to verify, interpret, even override what an algorithm suggests. And that's why I think training has to be deliberatively reinforcing those core skills while also at the same time teaching physicians and future physicians about how to integrate AI responsibly. And so I think the flip side to it is that I see some tremendous opportunity that AI can also enhance medical education. It can simulate cases, it can provide adaptive learning, it can give instant feedback on diagnostic reasoning. And I think that actually can make students sharper if we use it in the right way. But
No, I never thought of it in that frame, but yeah, I could see that too. Very
yeah, and
interesting.
then the third part or the third thing I wanted to say is I also think it's really important that we think about how we teach the next generation of physicians not just how to use AI, but how they're involved in building it as well. And so, you mentioned at the beginning of my bio that I work with programs like Stanford's Masters of Clinical Informatics and Management, and the University of Louisville Bluegrass Biodesign program that are both affiliated with the medical school. And these programs give physicians the tools to engage in innovation, in design, in technology development, because I really believe that we need doctors at the table shaping these solutions, not just consuming them.
Good, good. I have two more questions. This question is going to maybe hit home. Will AI replace some subspecialties such as radiology or pathology or even primary care? What do you say?
I think this is probably one of the most common questions I get, particularly since I am a radiologist. And, I want to be very clear about saying that AI is not going to replace radiology, pathology, primary care, or any of medicine. I do think it will fundamentally change how we practice medicine. An example that I use is from my own field that just as when radiology digitized and PACS came online, that was another time when people said that you're going to be out of a job, the sky is falling, we're done with this specialty. And, in retrospect, radiology has done just fine, but the job is fundamentally different than it was back then. And I think that radiology and pathology are often pointed to as the first targets for automation because so much of our work does involve images and pattern recognition. But I would also say that these fields are about far more than just reading scans or slides. So, in radiology, we also consult with referring physicians, we integrate clinical context, we decide which imaging studies are the most appropriate for what you're looking for, we communicate complex results to patients and the care teams as well. And I think those human elements, the judgment, the communication, the responsibility, that's not something that can be replaced by an algorithm. But what I think is more realistic is that AI is going to become a standard tool in these specialties. And so it might highlight a possible tumor that's subtle on CT. It might flag an abnormal cell on a pathology slide, might suggest a diagnosis in primary care, but it's still going to be the physician who confirms the findings, integrates it with everything else they know about the patient, and really makes the final call. And, in primary care, I think, just as I suggested earlier, I think the value of AI is in reducing the burden of practice. So ambient documentation, decision support, population health insights. But, for primary care, at its essence, it is relationship-based medicine. Knowing a
Right.
patient, understanding their life, building trust. I don't think that that's something that AI can replicate. And so I often put it this way that, AI is not going to replace doctors, but doctors who use AI effectively may replace those doctors who don't. And I think those specialties that embrace AI thoughtfully will actually become stronger, not weaker. And so, instead of thinking of AI as a threat to pathology, radiology, primary care, or any other specialty, I really think of it as a partner, as a tool that takes away some of those repetitive tasks, that gives us another set of eyes, and hopefully frees us to focus on the human parts of medicine that I would argue are the parts that matter the most.
Well, for my job security, I hope I better study up on AI. What do you think, huh? All right, last question. AI requires vast amounts of energy. We know that. And how do we provide this necessary energy to generate AI in medicine, and who is going to pay for it? How do you have any thoughts on that? What are your thoughts on that?
Yeah, I mean, I think you're absolutely right. the training and running of AI models takes a tremendous amount of energy. And I think that that is something that the tech industry as a whole is wrestling with. Now, in healthcare, I think the key point is that the costs that are incurred are going to have to be justified by the value to patient care, to outcomes, to cost, to experience. And I think that if AI can do things like keep people healthier, prevent hospitalizations, reduce waste, and give physicians more time with their patients, then the investment and the cost makes sense. But I think ultimately, developers and health systems that are going to be footing most of the infrastructure bill, that physicians and patients really shouldn't be stuck with those higher costs unless there is a clear benefit to that doctor-patient relationship, to health outcomes, and to patient care. And I would say that as an industry, we really should be pushing our technology partners to make AI development more energy efficient and sustainable as well.
Well, Dr. Ding, this has been very interesting and informative discussion. Do you have anything you would like to add before we close?
Other than just to thank you so much for the opportunity to join you, and to your listeners for listening today. This has been a tremendous amount of fun to chat with you, Nick, and I hope your listeners and you all have learned something today as well.
We have to get to meet in person one of these days. All right there, Alex?
I look forward to it. Absolutely.
All right. Well, that's very good. I have a few final thoughts before I end the podcast. AI may play a huge role in the future of medicine, but it should not and will not replace the physician. But it must reshape their roles. I think that's exactly what you referred to earlier. Doctors may become translators or supervisors of AI data, allowing us to focus more on the patient relationship, ethical judgments, and complex decision-making. The relationship between AI and human experience will and should be an equal partnership, but with that partnership comes regulation, transparency, and continued emphasis on compassionate care. Dr. Ding, again, thank you for joining us. This is Dr. Nick Biasotto. We've had a very interesting discussion about artificial intelligence and its role in medicine in the future. I'll be signing off. Be talking to you later.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. The executive producer of Delaware Healthcare Reality is Mark Thompson. Delaware Healthcare Reality is produced by Tom Mitten. For the Medical Society of Delaware, I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.
The AMA offers resources to help physicians navigate AI in healthcare. Visit ama-assn.org/AI for news updates, guidance on implementation, and advocacy work. On the AMA EdHub, you can find CME courses like the basics of AI in healthcare, the ethics of AI in healthcare, and the use of AI in diagnosis.